So my name is Katie Hoskins, and I'm the Research and Instruction Librarian at California Health Sciences University. Today's session is about tips for publishing a case report. This is part of a series organized by librarians at osteopathic medical schools to help you advance your research skills and support your scholarly activities. It's open to absolutely everyone, and we're glad to have you all here. The goals for today are that you're going to be able to describe the care guidelines for writing case reports, which includes considerations like informed consent, as well as to identify journals for submitting case reports. Okay, well, this is awesome. Loving that we have so many students with us today, as well as faculty, staff, and librarians. So thank you again, everyone, for being here, and I hope that this will be helpful for you. So let's start with what is a case report. It is always about, when the case report is about one person, so that N of one. And so because of that, it's only one, it is at the lowest level of the hierarchy of evidence and considered one of the weakest sources. And when people talk about the drawbacks of a case report, they often mention that there's no control group, that there's no comparison, they're not blinded, they don't address causality, and they don't provide prevalence statistics. The other thing is they're rarely cited, which will impact a journal's impact factor, a metric that some people use to evaluate journals. But they are still a valuable source of information, particularly when talking about new or rare diseases. This is where COVID first appeared in the literature. It's where Zika and other conditions first appeared. It's helpful for looking at treatments and adverse events. So not knowing sometimes that a certain treatment is going to have this unanticipated side effect. And that's where we've learned about different things as well. So case reports are still valuable sources of evidence, even if they're not as high up on the pyramid of evidence as other sources. So let's go ahead and get into this about how to get started. And that is going to go with identifying a potential case. And you want to think about, well, what's unique about this particular case? Is it an outcome, a diagnostic assessment, an intervention? Is it a new or rare disease? So you get to thinking about that. And then I would recommend that you do a quick literature search. You want to see if there's other case reports, because maybe your case isn't as unique as you think. The other thing that's helpful is see what your preceptor thinks and talk to some of the students at my university, and that's what they've done. And, oh, do you think this could be worth writing about as a case report? And in that case, the preceptor was like, I think you are right. This is kind of unique, and I think we could do something. So they have some of that clinical expertise that can be helpful in determining if a case is worth pursuing to make into a publication. It's also a good idea to see if they're interested in being a co-author / mentor. So another part about getting started is informed consent. This is recommended in the care guidelines that you should get patient consent from the patient, informed consent from the patient, and to be able to provide this to the journal if requested. You also want to look into, does the journal require it? And most journals these days do require that you have informed consent, a signed form from your patients. And I want to take a moment to show you BMJ case reports here because they have very specific requirements. And this is an example because many medical school libraries subscribe to BMJ case reports and have a fellowship code that allows medical students to submit as many case reports as they want for free to try and get published. But they have very stringent patient consent requirements outlined on their author instructions page. They require an informed consent document for all living patients, and they're not going to publish it without that. So if your hospital or medical facility has its own form, your patient can end up having to sign 2 forms. The other thing about BMJ, for example, is that they require that the patient have actually read the case report, and that's part of the informed consent form. And also, if the patient is deceased, which has come up as a question before, you do need to get permission from their next of kin. And there can be a lot of legalities here, so you may need to contact your institution's legal department. BMJ, as an example, also has additional recommendations for children or patients with mental or cognitive impairments. So if somebody perhaps is, like 16 years old and you want to do a case study, they may need to also provide their consent as well as their parents. The other aspect that's part of BMJ case reports that may be part of other journals are image requirements. So if there's a chance that a patient could be identified from a photograph or other image, then B&J specifically needs the patient's written consent for those images. So we covered those things and then obtain the informed consent before writing or submitting. And the big part of that is you don't want to be in the position of spending time writing a case report and then for it to not be accepted because you don't have patient consent, or even worse, retracted. And that has happened. And here's an example of this case report that was retracted. The first author was a resident at the time of publication. They reached out to the patient multiple times to try and get her permission, but they weren't able to get in touch with her. They decided to go ahead and publish the paper anyways, did their best to not include any identifiable information. Well, later on down the road, the patient read this article and I recognized herself in it. So then she asked the authors to retract it. They did. The interesting part here is that the publisher said they would remove all the images and text to make sure that the article wasn't searchable. Well, nothing ever truly disappears from the internet. And I was able to find the original PDF on Google Scholar, and which still also has the images. So that's why I blurred out the information here. This is, again, just reiterating, it's important to get that patient consent. It doesn't always prevent an article from being retracted. There are also cases where a patient has provided their consent and then retracted that. But it will still be a big help in the process to get that consent. Another aspect of getting started is de-identifying the patient. You may be familiar already with HIPAA's 18 direct identifiers, things like names and dates, account numbers, IP addresses. So all of these are considered direct identifiers. And when these are combined with information about someone's health status, their care, or their payment, it becomes protected health information, which has requirements to keep it protected. So in addition to those direct identifiers, you also need to consider indirect identifiers, like a really rare diagnosis, extreme age, like it's this person's 101 years old and this happened to them. An unusual occupation, sex or gender that is unusual for the disease. And then there's also considering the combination of factors, such as the treating physician's name, along with the admission year and diagnosis. So sometimes it's not just the pieces in alone, but in combination. All right, so we've covered all those pieces. Now let's talk about IRB approval. And a really brief thing about that, a case report is generally not considered research. Case report meaning one, if you have a case series, which would be two or more, then it might be considered research. It's always a good idea to consult the IRB just to check, because every institution is different and it's better to be safe than sorry, especially if your patient is considered part of a vulnerable population, like a child or a pregnant woman or so forth. That may be another reason that the IRB may want to review your case report. So getting into actually writing the case report, you would start with a working title. So be descriptive and yet short, always a challenge, right? And whatever your title is, you follow it with case report. So it's really clear from the title that it is a case report. You're going to gather information to create a timeline of what happened. And then you're actually going to create a timeline with visuals. So as you can see from this example, on the left, they have the symptoms, and on the right are the laboratory findings. So, and it brings it down into a timeline to make it easier to follow along. And from there, you can then write the narrative of what happened. So, and that narrative is going to include the chief complaints and relevant demographic information, being careful to make sure that you're not including those direct identifiers and limiting your indirect identifiers. It's going to include your clinical findings, the relevant past medical history, pertinent comorbidities, and important physical exam findings. Diagnostic assessments, so the testing and results, a differential diagnosis, and the diagnosis itself. It's also going to include the therapeutic interventions that you did and how they were administered, any kind of follow-up care, which could include intervention modification, interruption or discontinuation, how well was the intervention adhered to and how was this assessed, as well as any adverse effects or unanticipated events. Then you're going to get into why it happened. And that's where this is going to happen with the introduction. You're going to briefly summarize why this case report is important, why it might have happened. So in your discussion section, you're going to describe case management, including strengths and limitations with your scientific references. Then there's your conclusion, which is usually one paragraph. It offers the most important findings from the case without any references. So once you have written your case report in those different sections and you have your timeline, you're going to write the abstract, which is often easier to write when you are finished. And that's going to include your background, some key points from the case, main lessons to be learned from this case report. It is also not going to have any references or citations. And so that abstract is that brief summary. You're also going to provide 2 to 5 keywords that will identify important topics covered by your case report. This is something a lot of journals want, and it makes it easier for when you're searching, as well as you as the reader knowing, okay, these are some of the key concepts that are covered in this case report. So going back to informed consent and patient perspective, just refer back to what we already talked about informed consent. The care guidelines recommend that patients share their perspective on the treatments received. I've seen a number of case reports and it seems like this is hit or miss. But it may be something that you would like to consider doing since it's recommended. Your references, you want to make sure that you've included the appropriate references from the peer-reviewed scientific literature. And I would hope, obviously I'm a little bit biased, that you would have consulted a librarian earlier on in your literature search process to make sure you weren't overlooking anything. We're usually a pretty approachable bunch that are glad to help with those things. You want to also review the formatting of your citations. Each journal has its own citation style, and whether they're following Vancouver or AMA, or they have their own custom style. You want to make sure that you are using whatever is their specified style, which will be somewhere in their author instructions. You also want to check for formatting errors so that your work doesn't look sloppy. Then there's the acknowledgement section. So sometimes it's broken out into whether you had funding or there's conflicts of interest or it's just in the acknowledgement section. This is also the place to list anyone that doesn't meet authorship requirements. And I'm going to go more into that on the next slide. So the International Committee of Medical Journal Editors recommends that authorship be based on all 4 of the following criteria, and that they've had substantial contributions to the conception or design of the work, drafting the work or revising it critically, final approval of the version to be published, and agreement to be accountable for all aspects of the work. And it has to be all 4 of those requirements. So if someone doesn't meet those, they are supposed to be listed in your acknowledgements section, because otherwise it would be considered gift authorship, which isn't an ethical practice. So, and here's this example from a case report where you can see the author roles where the arrow is. This follows what is called the credit taxonomy, where it gets into specifics. So for this first author, Cameron, we can see that they helped with the writing, the original draft preparation, the writing, the review, and the editing, and so forth. For all the other authors, what were their roles in this article? And that's becoming more and more common these days. So all these elements that I've discussed constitute the care guidelines checklist. I've put the link here and I will copy and paste those links into the chat at the end. But it covers the things like the keywords, the abstract, your patient information. So this can be helpful for making sure that you stay organized and you meet all of the components. So then you've written your case report, you have your patient consent. Where do you publish it? Well, there are places like BMJ case reports that cover a range of topics, or there are more specific specialty journals like trauma case reports as an example. So depending upon a variety of different criteria that you may have, there are hundreds of different journals where you could try and publish your case report. Some places where you can find those lists to get started is the Care Guidelines does have a document on their website that provides the journal title, the publisher, if there's a sponsoring organization, and then whether or not they have an impact factor. I really like the Excel document that is found on this Florida State University LibGuide with the case reports, because it has quite a few It lists them by specialty, which is really nice if you are interested in that, as well as if there's an author fee to publish. So author fees are fairly common these days. It's what we usually part of the open access model, where you as the author pay to get your article published and edited and processed, where, I mean, not that it's a guarantee just because you pay money, but that process. And then the end user, anybody with the internet connection to be able to read it, can read it for free. So when you are considering the journal too, as you're thinking about the specialty, evaluate it. Think about, would you consider it to be a predatory or deceptive publisher? And this is this whole own topic. And we do have another Scholarly Snippets webinar on it. The Think, Check, Submit website, it gives you a nice little checklist for reviewing different journals to make that determination. Is it listed in PubMed? So by and large, a good indicator, but unfortunately, there are plenty of predatory or deceptive journals that have been found in PubMed. So that should not be just, oh, if it's in PubMed, it's not predatory. Unfortunately, that's not the case. And then that part about open access that I talked about, someone had asked in advance if there's any financial considerations for trying to publish a case report. This is it with the author fees. Are there any? And then if there are, does your university or hospital or organization have funds that can cover the publication fees? Or if not, or does your school have an institutional fellowship code for BMJ case reports? So this is the main financial consideration to think about. So these are the resources that I mentioned. I'm going to copy and paste them. Coming up next, we're going to be doing a session on poster design. I'll be doing that one as well. I'm going to grab those links. Would appreciate if you tell us how we did. Remember that these are just brief little snippets and that we can go on, and always elaborate more a little bit later. So I just pasted in the resources and then now the information for the next sessions. So if you have any questions, I will be glad to do my best to answer them.
Good job, Katie.
Thank you very much, Karen, and everyone else. Yes, Joseph.
Hey, thanks for all the information. It was really helpful. I just had one question regarding when it comes to stating like the competing interest in a funding statement. So if you don't have any competing interest and there's no funding, is it acceptable to just say like none, or should you actually have a sentence that says the authors declare that no grants or funding was supported for this case report?
That's a great question. I think it may depend upon the journal if they have specific wording. I think you could probably be okay doing either one, and then the editor would tell you if they wanted it to be phrased a certain way.
Okay, because I've seen the one journal I'm looking at, it's the JABFM, and everything I've seen as far as funding statement and competing interest, it's literally just after the fact said none. So I figured that would be okay. I just didn't know if there's a more specific recommendation.
I think that's perfect. You've looked at the journal, and if that's the one you're interested in submitting and that's what everything looks like, I would do the same.
Great, thank you.
You're very welcome.
For the informed consent, and you mentioned IRB, and the case reports may or may not need IRB consent. Therefore, it doesn't need to go through the IRB office, but if it requires, the IRB approval. So it may or may not need IRB approval, so it doesn't need to go through the whole approval process. But you did mention that it will require the informed consent form. And in cases like that, it may behoove the investigator to approach the IRB office and ask for an example of what an informed consent looks like. And this way you cover all bases.
Absolutely. I definitely encourage people to always reach out, and because especially they may have an example, and especially if the journal doesn't have their own form.
Yeah,
Thank you, Karen.
You would know, Katie. So thanks for your service on the CHSU IRB.
Of course.
So, thank you.
You're welcome. Joseph.
Hey, sorry, just one more question.
Sure.
So when it comes to putting this on a resume, if you do a case report and you submit it for publication to a journal, and you also intend on making a poster presentation of the same case report, do you list those as two separate like research experiences, or since it's technically the same case report, does that fall under one experience?
That's a good question. Usually what I see in a CV is that I see a separate section for publications, for presentations. And it would make sense that they would be listed twice because you would have done it in 2 different venues.
Okay, that makes sense. Thank you.
You're welcome. And you could even potentially list it if it's been accepted. I think it's fair to say accepted after it. You could still list it. But yeah, I think it's definitely okay to list it twice, depending if you present it and if it's been published.
Great, thank you.
You're welcome. Well, thank you so much. I hope to see you at our next session on poster design tips, and have a wonderful day.